Hello and welcome to the Functionally Enlightened podcast with Dr. Sharon Surita. We interview well-respected medical and functional practitioners, as well as patients who have overcome disabling chronic conditions, such as dysautonomia, and reclaimed their health. These enlightened guests provide helpful tips on managing chronic pain and illnesses, using a combination of traditional and whole-body healing modalities. If you're interested in natural healing and quality of life improvement, you're in the right place. Thank you for listening to today's episode.
Hello again, everyone. Thanks again for joining us on the Functionally Enlightened podcast. I'm your host, Dr. Sharon Surita. And today, similarly to our last full episode, I'm going to be going over some of my own chronic illness journey. I've received a few messages and comments from some of our listeners wanting to know a little bit more about what brought me into the functional health space. I believe my story might resonate with a lot of you out there who are experiencing chronic illness and have been trying to get a handle of your own symptoms. I'll take it back to where the disabling illnesses began, and that was in November of 2019. I've discussed it a little bit on some of the previous podcasts, but in November 2019, I had what was supposed to be a routine hernia repair surgery, and it was for an umbilical hernia, and also I wound up having a ventral hernia, and these two probably resulted from my second pregnancy where I had a C-section. But the general surgeon explained that the only way to have that repaired and have it last versus having the repair fail was to have a mesh placed. And many of you probably have heard of the hernia meshes that are being used. Most of them are synthetic. They are made of polypropylene, which is a form of plastic. But there are some hybrid meshes out there, and there's also biologic mesh. A lot of the general surgeons say that the biologic mesh is not going to be long-lasting, that once it incorporates, it starts losing some of the tensile strength. So they opt for the synthetic or the polypropylene mesh, and they consider that the gold standard. Well, structurally, yes. If you think about it, having a plastic screen hold your muscles together might structurally be more sound, but there's been substantial issues with mesh. In some people, it does migrate, which causes a lot of physical pain. A lot of people have recently been reacting to the mesh. So it's something that's called Asia syndrome, and the body will sense this as a foreign invader, similar to if you had a thorn in your finger or something, or a splinter. Your body rejects it, and they try to encapsulate it and prevent it from damaging other structures. So the same thing happens with mesh, but it doesn't go away. Yeah, the body can't excrete the mesh. It will tend to develop a biofilm. And on that biofilm, you could have a bacterial infection or some other type of inflammation that could be happening. And it's chronic. It will chronically be inflamed. That's what it's intended to do, so that it bridges the gap. But many people are experiencing negative and severely disabling side effects or symptoms from this mesh. I was one of those. It might not be apparent if it's not structural, if it's not an active infection that you can visibly see, or if it's not wound healing issues. In my instance, the wound was healing fine. On the surface, it looked great. The doctors couldn't figure it out, but I was immediately and completely disabled. Day one of the surgery, and I didn't ever feel right after. It was weeks and weeks. At first, they told me, in 3 to 4 days, I should start feeling better. That 3 to 4 days changed to 3 weeks. 3 weeks changed to 6 weeks. 6 weeks changed to 2 months. And after 4 months, I was just deteriorating even more. I couldn't eat solid food. I could barely walk. I had developed food sensitivities, heat intolerance. My blood pressure was dipping quite low. I was having tachycardia, and I didn't understand what was going on. So I just kept pushing along. I tried to eat, but I couldn't keep the food down. And I wound up losing over 40 pounds within the first 6 weeks, actually. I lost 40 pounds. And the general surgeon just brushed it off and said I was dealing with anxiety, and anxiety was the culprit. I understand how disabling anxiety can be, but this was not anxiety. It was more of a physiological issue where the symptoms were driving the mental anguish. So it was kind of all in one. And I know it can go either way. It could either be mental emotional driving your physical, or physical driving your mental emotional. So the symptoms provoked the anxiety. But what they were prescribing me, the pharmaceuticals to treat this, did nothing for any of the symptoms and actually caused a lot more severe side effects. On top of the gastrointestinal issues, on top of the weakness, the fatigue, the lightheadedness, I started getting other side effects like hyperhidrosis. So that was my hands, my palms and feet were sweating constantly. That's something I had never experienced, along with these other things. To make a long story a little bit shorter, after 4 months, I was able to find a surgeon who was knowledgeable in, negative impacts of mesh implants and understood that there could be immune responses. He was a lifesaver, and he did perform a surgery after 4 months to remove that mesh. Lo and behold, it was still intact. The mesh that was inside of me was a hybrid, and it was supposed to be absorbable. So the general surgeon said it was not able to be extracted. But after 4 months, it was completely intact, still the same size it was when implanted. He was able to extract everything out. Unfortunately, I had already suffered denervation of the abdominal wall, which means nerve damage. So my left flank no longer has muscle. It is paper thin, and MRIs show this. So there is no core strength left, and I am left wearing a binder 24/7. I've now been diagnosed with dysautonomia, and specifically POT, which I've discussed on prior episodes also, postural orthostatic tachycardia syndrome. I also have orthostatic hypotension and do suffer from mast cell activation syndrome. So those are the diagnoses that I've received that correlate with all of the symptoms that I had been experiencing. Now, my transition into the functional space has been one that was slow going. I did run around in the circles with the specialists and gastroenterologists, cardiologists, primary care doctors, and even ENTs. I've seen psychiatrists, neurologists, neurosurgeons. I've had so many diagnostic exams. Within those first 4 months, I had many emergency room visits just because how sick I was feeling and how I did suffer from a couple of seizures as well as just syncope episodes in general, all of them without answers. Well, the doctor's visits and, the emergency rooms, they're not built to take on chronic illness, but chronic illness patients don't know where to start, because they get pushed from doctor to doctor. And that's the sad part. That is my motivation for getting into the functional world, as I've been learning to manage my symptoms, manage my chronic illnesses, and even more so, trying to regain health and functionality. That is why I turned to functional diagnostic nutrition. And this has been an eye-opening experience for myself, and also looking at other people around me and trying to help them problem solve why their health has been declining over the years. It's not normal to have headaches every day. It's not normal to feel gastrointestinal problems like stomach aches and bloating. It's not normal to have brain fog all day long, or to feel such a fatigue that you might only be able to be up and about for 30 minutes a day. So those things are not normal, despite what you may hear from your doctors. And some people just say, oh, you're aging. It's all part of aging. Well, our bodies have an innate intelligence within every cell in our bodies, actually. And so when we're looking at the body as a whole, we're looking at all the activities and chemical reactions, and this is basically called metabolism. So when we're functioning properly, the metabolic processes are working in harmony, or what we call homeostasis. It keeps a balance between all of our functions, and that's what we need, is a balance. We don't need to just supplement because we're missing this on our labs. No, we don't need to take this pharmaceutical to treat this symptom alone. No, we need to look at the body as a whole and establish that balance. A loss of balance in one area is actually going to cascade into the other areas, and that's when we start experiencing symptoms. And most of the times, these symptoms are so far removed that we don't tie them to the critical system that is actually having the malfunction. So the aim is to look at all the hidden stressors in our lives and eliminate them, along with a few other pillars. So I'll briefly mention our 5 pillars. They are diet being critical. We've talked about it a few times, especially leaning on the metabolic typing diet, and also talking about food sensitivities and eliminating those as a stressor. Additionally, rest. A lot of people misinterpret rest as getting 5-6 hours of sleep at night, but rest goes far beyond that. Not only do we need to rest throughout the day in terms of unplugging from technology, especially nowadays. We have to unplug. We have to let our minds stop working as manager 24/7. I'm guilty of doing that. From the moment I wake up to the moment I go to sleep, my mind is constantly going. Learning to unplug from that and give ourselves some time to maybe meditate or do some visualization exercises. I try to do this every day, midday, every morning. As soon as I wake up, after I, of course, take care of personal hygiene, I sit down and I listen to something motivational, practice some meditation. And every night before I sleep also, some more meditation or gratitude journaling. So that's one form of rest. The other is the actual sleep component. And sleep is critical through my college years. I have 3 degrees, the bachelor, the master's, and the doctoral degrees in engineering. I worked multiple jobs, and then it was child raising time. I used to be a little prideful of the fact that I did all of these things. I worked full time, I went to school, and I did my workouts late night. I would get the kids to sleep around 9 p.m. and start my workout at 10, not knowing that I was creating this cascade of metabolic chaos that probably didn't help me to recover from those surgeries. We need to be asleep before 10 p.m. I know a lot of people rebel against that, especially as you're in your young adulthood or your parenting years. We tend to think, the evening hours are when I have my me time. I actually try to have lights out and I'm in sleep mode at 9 p.m. And I usually wake up around 5 in the morning. It might take me a little bit to go to sleep, but I make it my priority to try to get the best hours of sleep in between 10 and 2. Now, there's a lot of scientific studies that say that those are the hours that your body does more of the repair and rebuild functions. There's also time periods that certain organ systems are doing repair and recovery. So, for instance, I know I wake up usually between the hours of 1 to 3. I have to get up. Maybe I need to use the bathroom or I need to get an ice pack or something like that. I do still deal with chronic pain from the surgeries, and that's expected with actual structural damage. But between 1 and 3, that's the time frame for the liver. That's another indication that I still have some liver congestion issues that I've been working to resolve. And functional diagnostic nutrition has been instrumental in helping me to identify through my own labs and through my own learning which of my symptoms need more support. Going back, we have the diet. We talked about rest. We talk about exercise too. Exercise doesn't mean running a marathon. It does not mean powerlifting. It's going to be different for everyone, depending on where they are in their healing journey or in their health journey, we'll call it. Some people that might be more sensitive, might be more affected by the stresses in their life, they would be starting off slow. They would be doing maybe some walking and ideally some weightlifting, but definitely not going into, like I mentioned, powerlifting or those boot camps where you're keeping your heart rate up or you might be susceptible to injury. And then you have other people that have more vital reserve that they can do extra physical activity. It's all custom tailored depending on where the client is at that given moment. We'll develop a protocol based on so many things. We have questionnaires that help us assess the metabolic chaos that they're going through. We look at all of their current lifestyle practices. And then we also have our foundational labs. I went over 2 of them in a prior episode. And again, there was the MRT food sensitivity test and it was metabolic typing. So we talked about diet, rest, exercise, stress reduction. We briefly talked about that as well. A few of my practices in there, they run parallel to rest. So our stress reduction, we need to do simple things. It's difficult to actually implement in our lives initially, but it becomes simple. We can't overexert ourselves. We can't overcommit. If activities are too stressful, then we need to reevaluate if it's a necessary part of our lives. We can make adjustments to those things. One thing is staying up too late to finish off tasks. Well, there's always tomorrow. Overcommitting, like I said. Sometimes our family life is quite stressful. Our work life is stressful. Those are all individual too. And each person needs to assess what things can be tweaked to make it less stressful and tackle these things one at a time. Don't become overwhelmed by trying to do everything at one time. Maybe you can substitute one activity for another and so forth. So stress reduction. We have the internal and the external stressors. Food sensitivities here can play also as a stressor. We can eliminate those foods that might cause an immune response. Then our environment, trying to have cleaner air, cleaner water, cleaner food for sure. Cleaner food. We want to avoid those things that are sprayed with pesticides and herbicides. We want to get organic, knowing that there's still going to be some contaminants. We want to have grass-fed, antibiotic-free animal proteins. So you can see that all these components are still contributing to stressors. I'm sure you've heard many times, it's just stress. Well, yeah, stress is out there. Stress is everywhere, and stress is inside. Not just the foods and the air and the environment. Simple things like your personal hygiene products that many people have chemicals that they can't even pronounce. And those you should stay away from. You shouldn't put anything on your skin that you can't pronounce. unpronounced or that is not something that you would eat or potentially be able to consume. Anything like that that's toxic for your gut is also toxic for your skin. Your skin is a detox organ too, right? We want to take a look at our personal care products, keep fragrances away. Fragrances are all synthetic unless it's something like an essential oil. And that stuff, again, on an individual basis, looking at things one at a time, what things can be substituted, what things can we do without. Because in the long run, our health is more important. I don't know if that makes sense to you all, but I definitely have cleaned out all of my products. Most of the stuff I use is coconut oil based, beef tallow based. Now going to our last pillar of supplementation. We don't like to approach supplementation until we look at all of the other diet and lifestyle changes that can be made in a holistic way. So supplementation is something we'll look into after we review all of the labs and make those clinical correlations. And it's also highly dependent on the individual. So supplementation can be used to help balance some of the hormones. It can be used to help with what we call the mucosal barrier integrity. So this is going to help you with leaky gut. Supplementation can also be used to address gastrointestinal issues. We don't develop our supplemental protocols until after we've reviewed lifestyle, and we don't look into supplementation until we've assessed main concerns, we've reviewed their foundational labs, and we can see what things are out of balance. So we will look at things like the adrenal function and the circadian rhythm, the stress and sex hormone levels. We also look at something known as secretory IgA, which would give us insight to the immune system. There's additional labs that we run to look at the gastrointestinal issues. Our labs also help us to discern if there's poor protein digestion and absorption, which can indicate gut dysbiosis. It can give us insight into congested liver function or detox problems, and also oxidative stress in excess, which can basically accelerate cell aging. Looking into histamine and the diamine oxidase enzyme will give us insight if there's intestinal health issues like gas, bloating, diarrhea, constipation. It might give us information on if there is overgrowth or overcolonization of certain opportunistic bacteria, and also provides information on the immune response, inflammation, and detox. So the labs that we use are very easy to do at home and incredibly important because they help us assess or discern the function of fundamental systems within the body. And that includes your hormone, your immune, digestion, detoxification systems. It can also tell us about the nervous system. But with those, we would also need to take a look at the dietary pillar. Over the course of the last 4 years, I have educated myself. Initially, just in traditional labs where one analysis was red or out of range. And the doctors would just shrug their shoulders, and I would go on Google trying to figure out myself. And that's not a good thing to do. We see worst case scenarios when we do that, and really that adds to the stress. That adds to the stress of the unknown and also to the stress of thinking things are going to continue to decline. So it took me a long time to understand that. I couldn't figure it out with just traditional labs being run and seeing multiple doctors who are prescribing different pharmaceuticals and not putting together any protocols that actually correlated or that worked together. I did seek functional medicine. That's where I first started learning about the functional labs. And even at that point, I kind of was just taking a diagnostic lab, 2 here, 2 there, and they weren't really pieced well together. It would just result in seeing a couple of deficiencies that were treated directly and that did nothing to handle the overall malfunctioning of the body. It was not just one symptom that needed to be treated. So turning to these methodologies, I learned that these labs that are selected specifically because they communicate very well together are the labs to use to try to connect those missing pieces and to try to identify which systems in the body need to be supported better, which systems will impact the other systems. Through the program and through reviewing my own results, we've come up with good recommendations, and I'm implementing now a self-care protocol rather than a disease care or a symptom management protocol. I am extremely grateful that I've come across FDN. I am fortunate to have been able to take the course myself, and I am blessed to be able to also help other people journey to their own improvement of health. That being said, in later episodes, we'll be going over some more of my own results as well as some of our clients that have allowed us to share, and we're open to questions from any of you. Don't forget to subscribe to our podcast to get the latest updates, and also follow us on social media at Functionally Enlightened. Thank you again for listening, and we'll see you next time.
Dr. Sharon Surita is not a medical professional and is not providing healthcare, medical, or nutritional therapy services or attempting to diagnose, treat, prevent, or cure any physical, mental, or emotional issue. The information provided in this podcast is for the informational purposes only and is not intended to substitute professional medical advice, diagnosis, or treatment. Always seek advice from your physician or other qualified healthcare provider before undertaking a new health regimen. Do not disregard medical advice or delay seeking medical advice because of information you heard in this podcast. Do not start or stop any medications without speaking to your medical or mental health provider.